Welcome to Complete RN Solutions. One of the biggest changes in the Next Generation NCLEX is the emphasis on clinical judgment. The NCLEX doesn't just test what you know, it tests how you think. To measure this, it uses the Clinical Judgment Measurement Model, or CJMM, which is built on 6 essential cognitive skills every safe nurse must apply in clinical practice. The first cognitive skill is recognize cues. This means gathering relevant assessment information from multiple sources, including the patient's history, physical assessment, vital signs, laboratory results, diagnostic tests, and the medical record. Your job is to identify which findings are clinically significant and deserve further attention. Next is analyze cues. Now that you've collected the data, determine what it means. Connect the assessment findings to the patient's clinical condition. Ask yourself, are these findings expected? Unexpected? Do they suggest the patient's condition is improving, worsening, or remaining stable? This step transforms data into meaningful clinical information. The third cognitive skill is prioritize hypotheses. Patients often have multiple problems, but not all require immediate intervention. Determine the patient's most likely problems and decide which one poses the greatest risk. Always prioritize life-threatening conditions and patient safety. Once you've identified the priority problem, it's time to generate solutions. Develop evidence-based nursing interventions that address the patient's highest priority needs and move the patient toward the desired outcome. The fifth skill is take action. This is where you implement the nursing interventions you've selected. Provide safe, timely, and appropriate care while continuously monitoring the patient's response. The final cognitive skill is evaluate outcomes. Compare the patient's actual response to the expected outcome. If the goal has been achieved, continue the plan of care. If not, reassess the patient, identify new cues, and modify your interventions accordingly. Remember this sequence: recognize cues, analyze cues, prioritize hypotheses, generate solutions, take action, evaluate outcomes. These 6 cognitive skills are the foundation of clinical judgment and are integrated into every Next Generation NCLEX question. At Complete RN Solutions, our goal is to help you think like a safe, confident nurse, not just memorize answers. Thank you for watching, and I'll see you in the next NCLEX review.